Hi, in today's video, we're going to be talking about doctor comment fail number 3,485. I don't know. I made that up. Okay, before we go into that, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. You can do several things there. You can take a questionnaire. You can read over success stories. You can also schedule a consultation. All right, so when I say Dr. Fail 3,485 or something, so this comment was made to a patient and by another doctor after this patient suffered from a traumatic brain injury. And the result was after this traumatic brain injury, they developed an exotropia. Now, if you remember, exotropia is where the eyes turn outward or one eye turns out. So it might be that one eye turns out. It may be that they alternate and, switch between which eye turns out. It could even mean that both eyes slightly have a position or posture of turning out. But you can imagine that if a person has suffered from traumatic brain injury, the last thing they want to hear from a doctor is a negative comment about this, particularly whenever they may be concerned about how their vision is working for them post-trauma. And in this particular case, it's real concerning. If the eye is turning out and they've never had that happen before, they may be experiencing double vision. They may have blurry vision. They may have difficulty keeping their place with reading or staying focused. They may feel like they're kind of ADHD-like, where they can't stay on task for long periods of time. And so imagine yourself in this position. This individual had a traumatic brain injury and then had a resultant eye turn outward that's leaving them devastated and having problems with functioning in their daily life. And you go to the doctor to say, what can be done about this? This eye problem is existing for me. And the doctor says, somewhat callous-like, you'll just have to deal with it. There's literally nothing that you can do. And on top of that, if you even consider or think about doing some form of therapy or something like that, it's all a hoax and it's all crap. So don't even bother. It's a complete waste of your time. And walks out of the room. I know what I would think. 1, I'm never going back. 2, I'm telling everybody about that. Well, maybe not. Usually not too vindictive. But 3, I'm going to say, I'm going to say a prayer for that individual, quite honestly, because I should hope that they never, ever have to experience anything like that in themselves or in their own family. Because, maybe that's like their wake-up call. Maybe it's their karmic, thing that they need in order to think about the statements that they say to other patients and maybe have just a better chairside manner. Just imagine if that was you. Now, fortunately, that patient didn't kind of take that answer. Although they took that on the chin and they probably went home and maybe even had a good cry over it, they started getting busy and to work right away on looking at things that they could possibly do. And they didn't just take that really bad, callous no as an answer. So I'm really thankful and grateful because what we do at Vision for Life and Success is we don't make those kinds of statements, first of all. And second of all, we're like, there's usually something that can be done no matter what the situation is. And there are some exceptions, and we're trying to be very gentle and honest about that when they do exist. But for someone like this, after traumatic brain injury, what we're going to do is we're going to do a 2-phase type of system and treatment program. And the first phase is using Syntonix filters, which you've heard me talk about these all the time. But there's actually a cool filter that we use for brain injury. And so for patients who've had traumatic brain injury, it helps to increase blood flow in the brain again. And it also increases neuroconnections within the brain, which can somewhat be disrupted or shut down after traumatic brain injury, like a whiplash, or if it's even something serious like where they end up in a hospital or end up in a coma, and there's a lot of issues that maybe result at the end. So this filter, one of them, is used for traumatic brain injury, just to kind of help heal and restore the brain. And then we can use filters that work on the eye alignment issues, whether that is like an eye cross or an eye going outward. Let's see if I can find it. So for an eye cross, the filter tends to be a little bit more green, and we can look at that. And then for an eye going outward, as in this example of this person who I talked with, then it's kind of a green, but green-blue kind of a color. And so in addition to the neurological light stimulating filters, which is what these are, we call them that because we don't want to just think about them as something that you can just go off the shelf and buy at the store. You're not in your home goods store buying some filters you're gonna put on and like recharge your system, okay? Or you can't buy them on Amazon. And so this is something that is like highly sophisticated, because what it's doing is it's affecting your whole brain and neurological system, and we're trying to kind of reset things. So it's not just something that you want to try to play around with on your own. In addition, the second phase that we talked about is that we are doing vision therapy. And in vision therapy, there's a lot of different things that we're doing, typically for a traumatic brain injury type of case, or for a case of like an exotropia like this individual had. We would use certain tools like this. This is called an aperture rule. And they learned how to kind of point their eyes down into that single window to see the images down here on the card, and learn how to fuse that and put that together. And ultimately what that does is it helps to be able to reset how the eyes are lining up together as a team. This doesn't want to sit anymore. I messed with it and it's upset. There we go. We can use different things like lenses and even prisms. Even though we don't use prisms in glasses full time for most of our patients, we do highly recommend using them in a strategic plan of attack for our program whenever we're doing phase 2. And so those things can help people learn how to align their eyes better, as in the case of this individual. So you can see there's lots of things that can be done, and it certainly is not appropriate for any doctor ever to be that callous, first of all. But second of all, it's also not appropriate if a person doesn't really know that there's something that can be done or not done. I always say, like, I love to be a student. And for myself, I'm always looking at what comes next, or what else can I offer, or what is new research out there, or what's something different that I haven't thought of. And I try to keep a very open mind. And so as a doctor, I would just plead to other doctors and say, can we all please just do that, so that we're not saying things so callous like this? Because that doctor, unfortunately, probably just does not know that there are lots of things that can be done to help his patient. And again, thank goodness that individual didn't take his callous kind of no for an answer, and he went out and he did some research to find out what else is out there for him. Now, if you like this video, I would hope that you have already liked it. Subscribe to our channel if you've not done so already. Make sure you visit our website at visionforlifeworks.com, where you can take a questionnaire, read our success stories, but most importantly, if this is sounding like you or a loved one, it's time to schedule a consultation with me. And you can also call our office if you're local, 618-288-1489. And with that, if you know someone that this could help, please pass it on. Thank you.